Thanks, Rob. So I'm here to present on Young Minds and BDD, and as Rob said, my name is Dr. Amita Jassi, and I'm really fortunate to be part of the BDD Foundation, and I'm a trustee of the foundation and joined 18 months ago, which was really exciting, and we'll be able to share some of the exciting projects that we've been doing focusing on young people. I'm also a consultant clinical psychologist in South London and Maudsley in the National and Specialist OCD, BDD and Related Disorder Service. And this is the only specialist service in the UK for BDD for young people. So really excited to be here to share some of the work we're doing in the clinic too. So what I'll be doing today is kind of drawing on three themes. Thinking about how common BDD is in young people and the importance of that for us as a foundation, but also working in a national specialist clinic, is to understand how many young people are out there with body dysmorphic disorder. How many people do we have to reach? How many people need to access our support? So I'll be explaining a little bit about kind of what research has been done in the past and taking you up to the present day and what we understand about that. The second theme I'm going to be drawing on during this talk is just thinking about what BDD looks like in this group. And this is important for two reasons. One is we know typically it's really difficult for people with BDD to come forward to mental health services. So it's really important for people around them or for them themselves to be looking out for signs and symptoms of this. But also this leads on to kind of the third theme, that if we know more about what BDD looks like in young people, we can also tailor our interventions and treatment. And so I'll be sharing a little bit with you today about what we know about treatment and where treatments are going for body dysmorphic disorder in young people. So as I said, we'll be looking at this across sort of thinking about the past, sharing with you what's going on currently and aspirations for the future, drawing on these themes. So before I continue, why are we focusing on young people? Why is this conference focusing on young people? Well, about 2/3 of adults with BDD report that actually their BDD started before they were 18 years old. So it's not that they had a few signs and symptoms, they actually had body dysmorphic disorder before they were 18. So this makes it really vital to be identifying it early and intervening early. Looking at the average age of onset, the research suggests it's around 16 to 17 years old. So again, this is just further highlighting this is something that occurs in adolescence. And the most common age of onset is around 12 to 13. Not only that, we know adolescence is such a vital time in people's development. This is a time when they're negotiating kind of relationships. There's lots of, in the UK, there's lots of things that have to do with education, GCSEs, A-levels, and also developing their identity. It's such a vital time in their development. And if BDD comes along at this point, this can have devastating impacts, and it's really important that we offer support at this age. And yet, having said all that, awareness, research and treatments are so far behind that of adults. I mean, we know broadly speaking, our understanding of BDD has got so far to come and we've got lots to do. But even in the context of that, we are really behind in terms of our understanding of BDD in young people, so lots of work to do. So let me start my journey starting with the past. So how common is BDD? How common is it in young people? So the best quality studies to find out how common a disorder is to look at sort of population studies, look at kind of whole samples of a population, look at rates, and not to look at skewed samples in clinics and so forth. And there's only been a handful of studies that have looked at rates of BDD, and most of them have been in adults, so generally speaking, 18 and above. There's been one study in Germany that included young people sort of 14 and above, and the rates of BDD are seen to be between 1.7 and 2.9%. But as I said, not very many of those studies have included young people, so we're not quite sure on the rates. One study did have a look at this a bit, but actually it wasn't under 18s, it was 18 to 21-year-olds, and it seemed that the rates were slightly higher in that group compared to kind of the general population. And so then there's been research that's gone into schools and thinking, well, this is where young people are, yes, look at the rates there. And the rates seem about the same, about 1.7%. And you'll notice there, I've written probable BDD. So these rates of BDD have been taken by people doing self-report questionnaires. So they're not clinical kind of assessments to really establish if somebody's got that diagnosis. It's what young people are reporting themselves. And there's some sense that older adolescents, there might be higher rates. So that's where we're at the moment. And for us as a clinic, we work with OCD and BDD, so we know the rates are similar across both. So ideally, we should be seeing 50-50 in our clinic. Yet when I looked at kind of how many referrals we get for BDD in our specialist clinic, only 10% of the referrals that we get through are for BDD. So it's a really underrepresented condition in that people are not accessing the services. Yet we also know, looking at this research, that there's lots of young people out there that have body dysmorphic disorder. So then, what does BDD look like in this group? So there's been really small studies looking at thinking about past research and kind of samples of around 30 to 35 young people to look at characteristics. And they're not going to be representative samples, so it's hard to draw conclusions, but I'll share with you what we know so far. So compared to adults, what we do know is that young people potentially have poorer insight into their BDD, so they're more likely to be convinced this is due to due to their physical appearance rather than a psychological formulation of their difficulties. And the sad truth is also young people are more likely to think about taking their lives or make attempts on their lives, and that's the kind of the sad reality of this condition. And so for us as a clinic, that's really important to be thinking about in the support that we offer. Also, we know, as I mentioned earlier, having BDD when you're a young person can have devastating impacts in terms of education. So 2/3 of young people don't attend school regularly or not at all. So those studies that have been done rating BDD in schools are a bit flawed because lots of the young people who have BDD might not be attending school, so those rates are not super accurate. And we also know that lots of people, young people, desire kind of physical interventions and changes to their appearance to kind of make them feel better, and this is really common in young people. So that's what we know so far about what BDD looks like in young people. And then moving on to treatment. So there's been to date 8 what we call randomised control trials looking at treatments, and when I'm talking about treatment, there's 2 treatments. There's a psychological treatment, cognitive behaviour therapy, and another treatment, medication. So I'm going to be focusing on cognitive behaviour therapy, CBT. And there's been 8 randomised control trials looking at how effective this treatment is. And that's kind of the best quality type of ways of testing out an intervention. So testing out CBT against another treatment to see if there's better outcomes or a wait list and so forth. And of those 8 studies, there's only been 1 that's focused on young people, despite how common it is in this group. And that was carried out by David Montash-Coles and members of our team in 2015. So this graph basically shows a measure of BDD on the y-axis, the BDD Y-box, which lots of you may be familiar with. And you can see the dark dotted line shows that CBT is an effective treatment. So what they found is 40% of young people responded to CBT, and this means that they had a reduction on this measure of around 30% or more, and that lasted a week or more. And this shows this has got promise. It is a bit lagging compared to what we know the outcomes are in adults, but it shows there's promise in this treatment for young people. And then CBT is not supposed to just work for the time that you're having CBT. It's supposed to have longer-term impacts. You're supposed to learn things in treatment that then you can use beyond that. So some colleagues, Georgina Krebs and colleagues, looked at longer-term outcomes and found that at 12-month follow-up, half of the young people responded to treatment, and so this is really promising, and 23% remitted, so on this measure scored 16 or below, which is an indication that maybe BDD isn't around anymore. So there's a lot of promise in this treatment, but also some room for improvement. So this is where I get really excited, because I get to share with you where we're at now and what's going on in the foundation and the clinic and the work that we're doing. So taking you up to the present day. So earlier I mentioned there's been very few studies that have looked at rates of BDD in young people, and the Office of National Statistics do surveys of mental health difficulties. They've done it a few times, so once in 1999, 2004, and most recently in 2017. And they have kind of looked at various mental health difficulties over those years, and what they usually ask is for parents, teachers and young people to complete measures, and then clinicians have a look at that, and on the basis of information, they make clinical diagnoses. So a bit like what we do in clinic. So it's really kind of thorough studies, not relying just on self-report questionnaires. And actually, for the first time, so there was 9,000 young people involved in this, and for the first time, BDD was screened for and assessed in young people in the UK. So we've got the rates of BDD in the UK, and this is really important and exciting. This shows that BDD is being considered as an important mental health issue to be looking at in young people, and it's putting BDD on the map, and it's been a long time coming, so this is really important and exciting. And so I'm going to share with you some of the preliminary results. They came out in November last year. And what did they find? They found 1% of young people had met the criteria for body dysmorphic disorder. They also found that girls may be more likely to have BDD compared to boys, and also older adolescent girls had their higher rates. But I want you to take these results with a bit of caution that actually there's still work being done, so there's still further analysis to really find out whether these rates are true, and there's lots of work going on as we speak just to see if these are true findings. But I think the most important take-home message from this is BDD is on the map, and we've got an understanding of how many young people are out there in the UK suffering from this disorder and the people we need to reach out to. With that in mind, the clinic and the foundation are doing lots of different initiatives and strategies and work to raise awareness of BDD. We know from our clinic, young people often come to our service and say they spoke about their appearance concerns. It may have been dismissed as, well, you're an adolescent, of course you worry about your appearance, or misdiagnosed, or it's seen as an eating disorder, social anxiety. It's often missed. And actually research backs that up, that only 3% of people that come to clinic presenting their symptoms and they actually have BDD get diagnosed with it in the first place, so it gets underdiagnosed. So in our clinic, we're doing lots of work, kind of training, going into clinical services around the country, training teams up on what is BDD. That is kind of the level we're at. What are the signs and symptoms to look out for, and what support is out there, and what are the evidence-based treatments. And as part of that, we're developing resources. So you've heard about the bookstore already. There's a book that has been written by the clinic and with young people and their artwork and parents. And it's the first book for young people called Appearance Anxiety. I'm plugging it. The proceeds go to the BDD Foundation. There's lots of copies on the bookstore, so please go and have a look. And that's a book that we think is going to increase awareness and understanding of BDD. There's also lots of resources we're developing. So on the slide you can see a leaflet. That's just a simple leaflet saying what BDD is, what questions to ask, and then what to do. Again, have a look at our store and see what you think, and take copies and leave them in your GP surgeries, leave them out and about. It's really important to do that. And you may have seen that the foundation have been involved in lots of media work and the clinic, and there's lots of attention being drawn to this disorder, as Rob said earlier, which is really important. And that's to increase awareness of BDD more broadly in the public domain. So when people hear body dysmorphic disorder, they know what it is. And what are the effects of all this work? So for us in the clinic, we want to ensure that people are accessing services and that people are getting the support that they need. And actually taking a snapshot of this year, it's already increased in terms of the young people that are managing to access our service. So now it was 10% a year ago, and now 23% of the referrals that we get into the clinic are for BDD. So something is working. This is really important work, and we have to keep going because we've got quite a long way to go. And then Rob mentioned earlier that there's a schools project that we're doing with the foundation and the clinic. So we were very lucky to get sort of donations and a grant. And what this project is involving is developing resources and materials to go into schools and raise awareness of BDD. So all in that kind of same vein of trying to increase awareness. So teachers, if they're noticing young people aren't getting to school, asking, could that be because of BDD, and asking those questions. And we're really grateful to OCD Action, who we're working with on this project, who've kindly offered up their volunteers who will be going into schools. We'll be training them up on the materials that we're developing, and they'll be disseminating it around schools. And we're in the pilot phase of this, so it'd be important for us to see what impact this has. And as part of that, we've got some resources that we're developing. It'd be really great if you've got some time to go to the stall. We're in the corner outside, just to have a look at the materials and give us feedback before we start launching them into schools. And you would have seen on the programme that we, as part of this, we've developed an animation, and it's actually the premiere of that this afternoon. So there'll be red carpet, bring popcorn. It's incredible. I got a sneak preview of it earlier this week, and it's just amazing. So we're really excited to be sharing that with you. And the hope is that that will also be shared across schools and further. So lots of really exciting and important work going on to raise awareness. And then coming back to kind of more the research side of things and sort of drawing on the themes that I spoke about earlier. So what does BDD look like in young people? So what we're also really excited to share is that we're collating lots of information from the young people that are coming through our clinic, but also from our twin clinic in Sweden, the Karolinska Institute, which is another specialist clinic for young people with body dysmorphic disorder, and there's not many of them around in the world. And we've managed to collate information on around 170 young people, so this is the biggest sample to date. It's not huge, but big enough to have a look at some of the factors that I mentioned earlier. And what we're finding is similar results. So the things we found in those smaller groups of young people of around 30, some of the results are still holding for bigger groups. So this makes us feel more confident that what we're noticing in this group is perhaps true findings, and then that helps us think about what do we need to raise awareness on and what support do we need to offer. This also goes for school attendance. So as I said, about 2/3 of young people are not attending school, and that's been found in these kind of bigger samples, and also kind of desiring surgery. And also we've found that 10% of young people are often getting their procedures that they want as well. So this is really important for us to consider in our work. And then treatment. Well, as I mentioned, there's only been one trial to date, but actually as part of that collecting information from our clinics, we're also able to test out our treatment. So we've developed our treatment further since that trial. So in that trial, young people had 14 sessions, and I should have said that was compared to a sort of education kind of phone calls, and so we were comparing that in that trial. This is actually data where we're just having young people come through the clinic and they're having treatment with us, and we now offer 20 weekly sessions, and we've added bits to the treatment. And the good news is, in a nutshell, treatment is getting better for young people, and this is really exciting. So in the past, 40% had responded to treatment, and now we're looking at double that. Nearly 80% of the young people that are coming through to our services here and in Sweden are responding to treatment. It's having an impact. And nearly 60% are actually getting better from BDD by the end of treatment. So this is really important and exciting that if people can get to services, there is a good treatment out there. And this is cognitive behaviour therapy. And in follow-up, it gets even better. So even more people are responding and remitting. So this is really exciting and important stuff. I should just mention that there's lots of analysis still to be done on this. So some people were on medication, those were changed. It's not as in a trial, it's all very controlled, and this is more just naturally what happens. But there's pros to that, because these are generally people that are presented to clinics more representative of what we'll see. But I think the headline is we've got a good treatment, it's getting better, and this is really important to share. So, aspirations for the future, where is this going? What are the foundation, the clinic, working on, what's the vision? So we now have the biggest sample of young people in the UK. Around 900 young people have been screened positive for BDD. And we can look at the characteristics in a bigger group, so we can look even further and understand whether what we're finding in our clinic is representative of BDD out there. So this is really important stuff. This also helps us raise awareness of what to look out for in sort of schools, in families, of what are the indicators of body dysmorphic disorder. And the work that we're doing in schools, our vision is that at the moment we're going into schools and piloting this kind of raising awareness. We want to go into every school in the UK and beyond. We want every school to know what BDD is. We want to be sharing this animation across the UK and beyond, so that when people hear BDD, they know exactly what it is and know what to look out for, and that is the vision. And also, we want to understand kind of early signs and risk factors for BDD. So can we intervene sooner? So not only do we want to spot BDD sooner, but are there indicators early on, and could we be intervening? So for example, in eating disorders, lots of, there's a lot of Happy Be Me project, which is about developing positive body image. We know lots of people mention that they have bullying incidents early on, and that really impacts on them. Could we be doing something sooner? Can we be putting in more protective kind of factors and interventions sooner, so that it could kind of stop BDD in its tracks? That's kind of the aspiration for the future. And treatment, we've got a really good treatment, and this is exciting. We've got to develop it and test it further in proper trials, and then we want to disseminate it. Want to make it more accessible. That's the biggest thing, that, okay, we've got a good treatment, but can people actually access it? And there's been some exciting work in Sweden, where they're developing internet-based treatments, where what you get in the clinic, you get over the internet. So you still get therapist support, but actually therapists spend about a third of their time in what we say sessions. So instead of an hour, it's usually 20 minutes. So you can see even more people. And for people that are struggling to get to clinic, it means they can access this treatment, and it's an effective treatment. It's been found to be just as effective as face-to-face for some conditions. So there's so much scope to be developing a treatment that's accessible and that people can get sooner, so people can get better sooner. And our aspiration as a clinic, at the moment, our focus is just getting people knowing what BDD is. But our aspiration is, we've got a good treatment. We want to be going out there and training up clinicians to know how to do this treatment. And so young people don't have to get referred to a specialist clinic. They should be able to go to their local service, get the right diagnosis and get the right treatment. And that is something, our vision for the future. And we don't want to forget families, and we're doing lots of research in the clinic to think about the impact this has on families and how families get pulled into BDD, which is completely understandable. And so we're conducting research, and we want to make sure that treatments involve families, particularly for young people, and giving them ideas on what they should be doing. And so that is the aspiration for the future, that we can understand that a bit more and develop treatments further. And this is where I do another plug for a book. So next year, in August next year, we actually, myself and fellow trustees, Benedita and Nicole, have written a book. Now, I don't quite know how we've done this in our evenings and things, but it's come together, somehow we've done it. But there's a book out there that will be coming out for families to give them ideas on how to support their child with BDD. So look out for that in the bookstores next year. And there's lots of unanswered questions. We've got lots to learn about BDD. And I think for young people, the impact of social media, that is something I get asked quite a lot. So does social media cause BDD? No. But we can't ignore the influence. And lots of people that come through our clinic, with BDD, social media really does impact on sort of how they feel. It can perpetuate their distress. And we can't ignore the influence. And the reason I mention that at this point is we're really lucky that we have our next speaker, Tanya Gooden, who will be talking exactly about this, about social media, body image, and digital detox. So before I hand over to Tanya, I just want to acknowledge that this is a team effort. All the work that we've shared and our aspirations is very much about the foundation, so my fellow trustees at the foundation, my team at South London and Maudsley, and then my other team, in a way, and our twin clinic at the Karolinska Institute. So I just want to say thank you to all of them for their contributions to all the exciting work that we're doing in understanding BDD in young people. Thank you.